Down syndrome is a condition that some people are born with. It is not an illness or a disease. You cannot catch it from someone else. It is simply a part of who a person is, right from the very beginning of their life. Think of it like a set of instructions for building a body. Most people have a certain number of instruction books, which we call chromosomes. People with Down syndrome have a little extra genetic material. This extra information changes how their body and brain develop. It is important to know that this condition happens naturally. It is not caused by anything the parents did before or during the pregnancy. It can happen in any family, in any country, all over the world. This condition affects people in different ways. For some, the effects might be mild. For others, they might be more noticeable. The extra genetic material can lead to certain physical features. It can also cause some level of intellectual disability. This means that learning new things might take a bit more time. For example, a child with Down syndrome might learn to walk or talk a little later than other children. However, this does not stop them from learning. They just follow their own unique path and timeline for development. With love, support, and the right kind of help, they can achieve many wonderful things in life. It's helpful to understand that every single person with Down syndrome is an individual. Just like everyone else, they have their own unique personality. They have their own strengths, weaknesses, likes, and dislikes. Some might love music and dancing. Others might be talented artists or great swimmers. They feel all the same emotions we do. They feel happiness, sadness, excitement, and love. They form deep friendships and meaningful relationships. Seeing the person first, before the condition, is the most important step in understanding and connecting with them. They are more like us than they are different. The name Down syndrome comes from Dr. John Langdon Down. He was the first doctor to describe the condition in detail back in 1866. He noticed that some of his patients shared similar physical characteristics. However, it wasn't until many years later, in 1959, that scientists discovered the genetic reason behind it. Today, our understanding has grown so much. We know that people with Down syndrome can go to school, get jobs, have hobbies, and be active members of their communities. They contribute to society in many positive ways. They teach us about patience, unconditional love, and finding joy in the simple things. When a baby is born with Down syndrome, doctors can often recognize some common physical signs. One of the most noticeable features is the shape of the eyes. They may have an upward slant similar to the shape of an almond. You might also see small skin folds on the inner corner of the eyes. Another common trait is a flattened facial profile. This means the bridge of the nose might look a little flatter, and the face might appear less rounded. These are just surface-level features. They do not affect the person's health or ability to see. They are simply part of the unique physical makeup caused by the extra genetic material. Other physical signs can also be present. Many individuals with Down syndrome have a single deep crease that runs across the palm of their hand. Most people have 2 or 3 of these lines. They might also have smaller ears and a smaller mouth. Because the mouth is smaller, the tongue may appear larger and stick out slightly. Their muscle tone might be lower than average, which doctors call hypotonia. This can make their bodies seem a bit floppy when they are babies. It can also affect their coordination and motor skills as they grow, making things like holding a pencil or buttoning a shirt a little more challenging at first. Beyond the physical traits, there are also developmental signs. People with Down syndrome typically experience some degree of intellectual and developmental delay. This means they learn at a slower pace. For a child, this might mean reaching milestones like sitting up, crawling, walking, and talking later than their peers. Their speech might be difficult to understand at first, and they may need speech therapy to help them communicate more clearly. Learning in school can also be a challenge. They may need things explained in a simpler way or need more time to complete tasks. However, it is a myth that they cannot learn. They can, and they do, all throughout their lives. It is crucial to remember that no 2 people with Down syndrome are exactly alike. Some individuals will have many of these traits, while others may only have a few. The level of intellectual disability also varies greatly from person to person. Some may be able to live very independently, while others might need more support with daily activities. Some people with Down syndrome may also have related health issues, such as heart conditions, or problems with their hearing or vision. That is why regular checkups with doctors are so important to keep them healthy and well. To understand what causes Down syndrome, we need to think about chromosomes. Chromosomes are tiny, thread-like structures found inside the cells of our bodies. They are like instruction manuals that tell our bodies how to grow and function. They carry all of our genetic information. A typical person has 46 chromosomes in each cell, arranged in 23 pairs. We get one set of 23 from our mother and the other set of 23 from our father. These chromosomes are numbered from 1 to 22, with the 23rd pair determining our biological sex. This genetic blueprint is what makes each of us unique, influencing everything from our eye color to our height. Down syndrome occurs because of a mistake that happens very early in development, usually before a baby is even conceived. This mistake involves the 21st chromosome. In most cases of Down syndrome, a person has an extra copy of this specific chromosome. So instead of having 2 copies of chromosome 21, they have 3. This is why the condition is also known by the medical name trisomy 21, which simply means 3 copies of chromosome 21. This extra chromosome is present in every cell of the body. It is this additional genetic material that leads to the physical and developmental characteristics associated with the condition. It is very important to understand that this is a random event. Nothing the mother or father did caused this to happen. It is a biological accident that can occur during the formation of the egg or sperm cell. The risk of having a child with Down syndrome does increase as a woman gets older, but the majority of babies with Down syndrome are born to mothers who are younger than 35. This is simply because younger women have more babies overall. Down syndrome is not hereditary in most cases, meaning it usually does not run in families. It is a spontaneous event that can happen to anyone. In a very small number of cases, Down syndrome is caused by a different type of chromosomal error. This is called translocation, where part of chromosome 21 attaches to another chromosome. In another rare form, called mosaicism, the extra chromosome is only present in some of the body's cells, but not all of them. People with mosaic Down syndrome may have fewer of the typical characteristics of the condition. Regardless of the type, the underlying cause is always the same: the presence of extra genetic material from chromosome 21, which alters the body's developmental plan. There is no cure for Down syndrome because it is not a disease to be cured. Instead, the focus is on support and treatment for any health or developmental issues that may arise. The goal is to help each person live a healthy, happy, and productive life. This support starts right from birth. Early intervention programs are incredibly important. These programs provide therapies to help young children develop key skills. For example, physical therapy can help improve muscle tone and motor skills like sitting, crawling, and walking. It builds a strong foundation for a child's physical development. Speech therapy is another critical part of the support system. Many children with Down syndrome have difficulty with language and articulation. A speech therapist can work with them on making sounds, using words, and forming sentences. They might also teach sign language as an early way to communicate, which can reduce frustration. Occupational therapy is also very helpful. This type of therapy focuses on the skills needed for daily living. An occupational therapist can help a child learn to feed and dress themselves, hold a crayon, or use a computer. These therapies work together to help children become more independent. As individuals with Down syndrome grow, their support needs change. In school, they often benefit from inclusive classrooms where they learn alongside their peers. They may have an individualized education plan, or IEP, which is a special plan created by teachers and parents to help them succeed. This might include extra help from a special education teacher, modified assignments, or assistive technology. The social aspect of school is just as important. Being in a classroom with other children helps them build friendships, learn social rules, and feel like a valued part of the community. Today, thanks to better medical care and more inclusive communities, people with Down syndrome are living longer and fuller lives than ever before. Many adults with Down syndrome hold jobs, live in their own homes or in group settings, and have active social lives. They have talents, dreams, and the desire to contribute to the world. The key is focusing on what they can do, not what they cannot. By providing the right support, encouragement, and opportunities, we can help them reach their full potential. They remind us that a life filled with love, joy, and purpose is possible for everyone.